Hi, I'm Katie Leikam, licensed clinical social worker, expert specialist with the trans community. I want to thank you for watching this video, but if it's a little too long, there are timestamps down at the bottom, and each question that I answer, you can just jump to the time if you want that information only. So thanks again. So I have my master's degree in social work. I have an MBA, and I'm a licensed clinical social worker. I have 12 to 15 years of experience in working with the trans community, and I've seen over 1,500 trans clients. I'm also certified by the World Professional Association of Transgender Health, which is the governing scientific body throughout the world for making the standards of care that all doctors and therapists and voice coaches use when working with the trans community. What my certification means is that I'm extensively trained to work with the trans community, and I know the standards of care 8 like the back of my hand, and I've also had hours and hours of continuing education about working with the trans community, been under mentorship with someone who is even more experienced than I am, and also taken a large certification test. So I hope with all my education and experience, you can trust me with your care. I believe you can. So people ask me that question a lot, is how did you get into doing what you do? And it's kind of a long story, but I'll make it as short as possible. I was managing a local coffee shop as a townie in Athens, Georgia, about 20 years ago, and I made a friend who worked with like the computer system there, and we became friends, and the person moved out of state, and they were gone for like 5 years or so, maybe less, maybe 3, and when they came back, they had transitioned and they were a woman. And that was my first time knowingly meeting a trans person. And it was good. It was great. I got to know my friend, and we became best friends. And she happened to run a meetup group in Atlanta, Georgia, where many trans women got together and had dinner once a month. And she started taking me there, and I met all these wonderful, amazing trans women. But we're talking about 15, 20 years ago now, and they had to go through so much to transition. They had to dress as a woman and present feminine for a year before a therapist would give them a hormone letter. They had to be in therapy for 6 months to a year before a therapist would give them a hormone letter. And they had to go through divorces, and they would get fired from work. It was just awful how the atmosphere was so long ago, and the barriers. And when I saw these barriers at this dinner, I got madder and madder, because I really cared for these women. I didn't want them to have to go through all that. So I decided, like right then and there, that when I got fully licensed, I was going to open a private practice specializing in working with the trans community, and I was going to write hormone letters in one session, and I was going to learn to write surgery letters in one session as well, to break down those barriers. And that's why I do what I do. Gender therapy is at the heart of my practice. What I love most is exploring gender identity with my clients, be it teens or adults. When you find out that you're trans, or when you think you need to start exploring your gender identity, you need somebody who's experienced, who's walked with over 1,500 trans clients through their journey. I love it when clients come to me and they tell me their eggs just cracked and they are ready. And I love it when clients come to me and they really, really, really want to take the time to explore and, dig deep before they decide to do any social or medical transition. I'm here for you no matter your pace. I'm here for you to help you through your transition. Along with writing letters, it's not the only thing I do. I know I talk about it a lot, but it's not the only thing I do. I do offer individual therapy, and I do some family therapy as well. So for individual therapy, I have a caseload of people, and they come see me either weekly or every other week. And that's where you really dig deep into who you are and issues and concerns you might have, and struggles that someone might have to come to be a better person or to be more stable in life. And then for family therapy, I see trans kids and some LGBTQ kids, and so I will bring parents in sometimes on sessions, especially if I have parents that are struggling to understand their kiddo that's trans, and we need to all come together to come up with a game plan for being affirming and positive at home. So as a therapist, I tend to be a little bit direct with some humor, maybe talking about some music or your fandoms that you like. I love throwing that in there. And it's not that I'm just direct all the time. I can definitely be empathetic and be a good listening ear for you. But I also challenge my clients and call them out on their shit sometimes. And that's just who I am. That's what it's like working with me. I use solution-focused therapy, which is kind of a brief modality, especially with my trans clients who are exploring their gender to get to where they want to be. If you could be who you want to be, how would that look? How do you get there? I also use mindful self-compassion, which is being kind to yourself and learning self-compassion for yourself. And then I use a little bit of existential therapy as to who is in this world? Why are we doing what we do? What is the purpose in life? So those are some of the modalities I use on top of some CBT and a little bit of DBT, and working with me. Community. I love working with autistic people, and I love working with the ADHD community. I know that through life, autistic people are made to mask and fit into society in the way that society feels like they should fit in. And so in sessions, we break that down. We talk about how exhausting it is to mask, and how to be your own person, and how to, get through the workload of the day, and just the nuances of being autistic in society. And then with ADHD, I like talking to, for instance, college kids or people in the workforce who are trying to juggle keeping up with their assignments or their job, and struggling with that attention and focus. And I also have lived experience with the ADHD. As a chronic pain and chronic illness person myself, some people like to call us warriors. I know the struggle it is to be exhausted every day. I know what it means to run out of spoons within the first couple of hours of the day. I know that you're your own case manager, you're your own advocate. I know that there's fat phobia in the doctor's office. I know that people who are oppressed, especially trans people and people in the LGBTQ community, have a harder time when they have chronic pain and illness. They have a harder time in the doctor's office. I know it's difficult, especially if you're misgendered on top of trying to go to the doctor with chronic pain and illness. So I love working with clients who are like me, who are often just struggling to get through the day. And you put on top of that work responsibilities or home responsibilities or pet responsibilities, and it's just so much. You just need somebody to talk to, somebody to hold space for you through all that. And that's what I love doing. I love working with people who have religious trauma. I also teach a continuing education course on religious trauma syndrome with the LGBTQ community. As a former Southern Baptist, I know how hard it is to be in this community and be queer or trans and be told that you're going to be condemned or you're going to go to hell, especially when you're grappling with still believing in God or a higher power. Or if you're grappling with no longer believing in anything, and maybe your family's super religious and you've got to figure out how to navigate that. that's how I love working with religious trauma. I really enjoyed writing the Gender Identity Journal. I'd always wanted to be a writer and publish a book ever since middle school. I used to write in journals and write poetry all the time. In fact, before I went to school for a psychology degree, before my graduate studies, I was an English major. So I loved writing the book. What I love about the book is that it's not just me being the authority and telling people whether or not they're trans or what some litmus test is to figure out if you're trans. It's really you exploring your identity and you asking yourselves the tough questions and you building up your safety net and your self-care routine so that if you are trans, you have a wonderful starting off point, especially to use in conjunction in therapy with me or with another therapist. If you have decided that you'd love to work with me, I am so honored and I would be so happy to walk with you on your journey. I've made it pretty easy for people to reach out to me. You can either call me and text me. I often don't answer the phone because I could be in session or with another client, so be sure to leave a voicemail or you can text me at the same number. Or you can email me directly to my email address, or you can use the contact form on my website and that'll send me an email as well. If you're sure you want to work with me and understand fees and super bills and all that good stuff, then you can actually self-schedule an appointment right directly from my website. I usually keep my availability open for a couple of months so you can make an appointment that works directly with you.